Hi, my name is Harshal. I help you on medical coding and few of them who are preparing for certification of medical coding. I do help, everyone over there. All right, moving on to this question. This is a question set from a radiology chapter. You'll require obviously a CPT book to answer those questions. As you can see, I'll read out the question for you. You got to answer from these four options. If you have already got the answer, why not move forward to 20-30 seconds and you will get your answer as well, and vice versa can move on to the next question. The reading out this question: a patient presents with a palpable lump in the right breast. The physician orders a unilateral diagnostic mammogram of the right breast, including computer aided detection when performed. No screening studies performed during this encounter. You got these four options. All right, answer to this question is option A, 77065, as it describes diagnostic mammography, including CAD, that is computer aided detection whenever performed, and rest of the code's information is given over here. Moving on to the next question. A patient undergoes a complete abdominal ultrasound examination. The physician documents visualization of the liver, gallbladder, pancreas, spleen, kidney, aorta, vena cava. However, the common bile duct could not be visualized because of excessive bile gas. What is the appropriate code over here? The correct answer to this question is option A, 76700. Why? Because the common bile duct was not visualized due to gas. That is why, therefore, the study remains complete. Right. Moving on to the next question. A patient undergoes a CT scan of the thorax without contrast material. The radiologist interprets the images and generates a final report. A contrast is administered before or after the examination. What is the appropriate CPT code here? If you like what I'm doing, please like this video. Please subscribe to this channel, man. And also do let me know in the comments. I mean, any feedback, any query, any correction if I have done something wrong. On if you're looking for something in particular in medical coding, do let me know as well. Yeah, I'll try to push more content on that particular thing. The right answer to this question is option A, 71250, as it is what it describes as CT of the thorax without contrast, which is what exactly we are looking for and mentioned as same in the question as well. Moving on to the next one. A radiologist performs fluoroscopic guidance during a spinal injection procedure. Permanent images are recorded and included in the patient's medical record. Find the appropriate code here among the four. The right answer to this question is option 77003C. So it describes the fluoroscopic guidance and localization of the particular procedure we were looking for. Moving on to the next question. A physician orders an MRI of the cervical spine with contrast only. Contrast materials administered before the imaging begins, and no pre-contrast images are obtained. Also, please, I'm requesting you to please like this video and tell me in the comments if these questions were too easy for you. I'll increase the difficulty level on the next one though. Option B, 72142 is the right answer to this question. I'm sorry if you have not got the answer. I don't generally do that. I make sure I tell you guys to pause the video because I'm going to say the answer. All right, one on me. At 7417242 represents MRI of the cervical spine with contrast only. Therefore, you have got exactly what we are looking for on best of question. Moving on to question 6. A patient undergoes a chest a radiographic examination consisting of frontal, lateral, oblique views. A total of 3 views are obtained and documented. Get the right CPT among these 4. All right. Answer to this question is option C, 71047. As it describes a chest radiological examination with how many views? Three views. Moving on to the next one. A patient presents with hematuria. A physician orders a limited retroperitoneal ultrasound focused solely on evaluation of the kidneys and urinary bladder. What is the appropriate CPT code reported here among the four options? The answer to this question is option B, 76775, as it actually describes as limited retroperitoneal ultrasound, which you are exactly looking for. Moving on to question 8. A patient undergoes MRI of the brain without contrast. After review of the initial images, the radiologist determines additional post-contrast images that are medically necessary, and contrast is subsequently administered during the same session. Find the best code among the four. So the answer to this question is option C, 70553. As when an MRI study is performed, both without contrast and then with contrast during the same session, this score is reported. Moving on to last second question on this video. You still haven't liked it. If you have not, please. A patient undergoes a complete non-obstetric transabdominal pelvic ultrasound. The uterus and adnexal structures are evaluated. During the same encounter, a separate transvaginal ultrasound is also performed for better visualization of the ovaries. Get the best possible code among these four. Answer to this question, number 9, is option C. Why? Because pelvic ultrasound and an ultrasound of transvaginal are distinct procedures. They meant they are supposed to be different procedures, not the same procedure. And that is why both code may be reported made medically necessary and appropriately documented. Moving on to last question. Another reminder, if you have not subscribed, please, you know what to do. A hospital owns the imaging equipment and employs a technologist who performs a CT scan of the abdomen with contrast. An independent radiologist interprets the study and prepares the final report. Which modifier should be radiologist append the CPT code when billing only for the interpretation? Should take around 30 seconds for you guys to answer, and then you know what, we'll end the video and I'll meet you in the next one. My name is Harshal and this is Decode Healthcare with Harshal. Alright, if you have not got the answer, pause the video because I'm going to show you the answer to this question. Option B, that is 26 modifier. It is the modifier where we use it to report a professional component of whatever service, not just radiological service, because this includes interpretation and report generation. The technical component, TC, is built by the entity providing the equipment, supplies, and technical staff. All right, that's it with this one. I'll meet you in the next one. Till then, you can